Hello, everyone. This is Dr. Pallavi Gowda. Welcome to Pulse. I'm so excited to have you here on this Halloween day. Happy Halloween to everyone. And as you may know, I'm an internal medicine doctor. And today we are talking about something very important and pertinent to Halloween, dental awareness. We're going to learn all about cavities. We're going to learn why it's important to know about it, how it can happen, what kind of things we can do to empower ourselves and take care of our teeth, and some disease processes and what we can do to prevent them and not get them, right? So important thing to note is that, all of the advice that's given today is really based on evidence-based medicine, and really any changes that you make to your lifestyle before implementing any changes, recommend speaking to your doctor, your dentist, in the interest of your own personalized healthcare. But all of these recommendations are generalized. And so let me introduce the guest today. So first we have Dr. Shweta Kokate, and let me just, so she's a general dentist practicing in Reston, Virginia. So shout out to our Northern Virginia residents. She is a dentist who trained in India and then came here and did her dental degree from the Virginia Commonwealth University. She enjoys blogging, she enjoys dancing, she's a beauty pageant holder, and she's absolutely gorgeous. And she also does a lot of community service activities, as well as being a proud mother to two young girls. She's a real all-time hustler. Now, today's a special episode because we have two guests. We normally have one, but today we have two. And our other guest is Dr. Sathiyanathan Nadarajah. He did his dental school in India and also did dental school in the University of Pennsylvania. He did a residency program in periodontics and dental implantology from the University of Maryland School of Dentistry, and he's currently a faculty member there and teaching periodontal residents. So welcome to both of you. I'm so excited to have you both on. Dr. Kokate, you want to say a quick hello?
Hi, Pallavi. It's a pleasure to be here on your show. How are you doing?
I'm doing well. Dr. Nadarajah, you want to say hello?
Yes, thank you for giving me this opportunity to join you in this wonderful program, and hopefully your guests will take home some messages from this interview process.
Yes, most definitely. And I usually like to include the hobbies of both of my guests. And so I know, Dr. Nadarajah, you're an excellent cook. And so that's one thing that you enjoy doing. You also enjoy volunteering in various community organizations. So that's wonderful. Both of you are involved in the community. And so that's fabulous. Now let's get started. So when we're talking about dental health awareness, and especially as I mentioned during Halloween, we want to know about cavities, right? That's the elephant in the room, is knowing how it forms and what we can do to take care of our dental health better. So Dr. Kokate, can you get started and tell us how we can take care of our teeth and prevent cavities?
Absolutely. Well, it sounds simple, and that could be one of the most popular questions that I get from my patients. We usually hear patients say, hey, I brush my teeth every single day. I floss my teeth. Why am I getting these cavities? Every single time I come to you, why do you think I'm getting cavities? So to answer that, basically, you need to understand how a person gets a cavity. It's pretty basic, okay? Let me break it down for you. To get a cavity, you need three things. First of all, you need food. That's what we eat every single day. We need to survive. You need acid in the mouth so that the bacteria can work on the food. So these are the three things: food, bacteria, and acid. Now, the food, whatever we eat, it's always sitting around on your teeth. The more it stays on your teeth, the longer it stays on our teeth, that's when you get cavities. Bacteria. Now, all of us have bacteria, good bacteria, bad bacteria. Now, when this bacteria is more in number, those are the people who get more cavities. Sometimes people don't have that tendency to have this bacteria to be there present in excess, and those people are the ones who don't usually get cavities. Now, the third thing is acid. Our saliva, Pallavi, it's acidic in nature, as you know. Whenever the pH drops below 5, whenever it gets acidic, that's when you're gonna get cavities. Now, this is a triangle. If you break any one of that things, any one of that triangles, I will tell you, you're not going to get cavities. Don't let the food sitting around on your teeth. Don't let your saliva get acidic. What can you do? Drink more and more water. Try to limit the soda, all the acidic substances that you put in your mouth. And third thing is bacteria. Well, all the plaque that sits on your mouth in the morning, when you wake up, you see all that white, powdery, chalky stuff on your teeth. That's all plaque. Just brush it off, floss it off. So it's as I said, it's pretty basic. Once you understand these three things are linked together, and if you break that triangle, it becomes easier. You can limit the cavities in your mouth.
Wow, that is beautifully explained. So food, bacteria, acid. Okay, so those are our kind of triggers for getting a cavity, and that's what we want to
Yes.
minimize our risk by taking care of those elements. That's interesting.
Absolutely.
With actually just saying those things, that leads to me to the next question. What can we do to prevent a cavity? How many times should we brush? There's all sorts of different brushes on the market. It's kind of overwhelming, actually, right? Can you break it down, and what do you recommend?
Sure. Now, take it with a grain of salt. It might sound a whole lot of things, but ideally, you should be brushing 2 times a day, Pallavi. As soon as you wake up in the morning and right before you go to bed. Okay. Those are the 2 times I recommend my patients to brush and floss. Now, the bonus would be if you're trying to add more tools like water pick. Do you know what a water pick is? Have you heard of water pick, Pallavi? Do you have one?
I have. Yeah, tell us about it.
I love it. I love my patients when they say I have a water pick and I use it every day. So this is what my 7-year-old taught me. She loves water picking. Every single night she water picks her teeth. It's a tool that's like a pressure jet of water stream that you can use to flush out all the bacteria from your teeth around the gums.
Wow.
So the way you use it before going to bed, I personally recommend brush your teeth, floss it. If you can imagine, while flossing, when you use the thread, you go in between your teeth. Your toothbrush, Pallavi, is so big, the bristle, a single bristle, there is no way the toothbrush bristle is going to go in between your teeth. And that's exactly where we see a lot of patients getting cavities. So you need to make sure you're cleaning it on the top, in between, everywhere around your mouth.
Oh, okay. Yeah. And what about the manual versus electric toothbrushes?
Well, that's a good question. Again, a lot of people say I use manual toothbrush, I use electric toothbrush. Now, the literature, what it says regarding brushing is, if you do the technique wise, if you're right, if you're using the manual brush for a good amount of time, that is recommended. And if you're using it correctly, it cleans your teeth as well as an electric toothbrush. Now, the challenges come when it's a busy lifestyle that everybody has. We have to go to work, we're just like working moms. We don't really spend that much of time with brushing. You think you reached all the way back, but no, that's exactly where you missed. And that's the tooth that is going to start hurting you. That's the tooth that is going to start getting you cavities. So brush your teeth. I would recommend using electric toothbrushes if you think you don't have time, because there are toothbrushes that have some apps that will remind you for how long you're going to brush your tooth. And it's good initially. It's okay to use that as a reminder and to get into habit, right? So electric toothbrush, yes, use them. Some people, now let's say elderly people have dexterity issues, people with arthritis. If they cannot use the manual toothbrush And if they cannot use their hands properly, I recommend using electric toothbrush. That will help serve them better for sure.
Ah, I see, I see. Yes, and the one I have lights up and it starts buzzing when it's like 2 minutes, or I think it's programmed to 2 minutes and it starts flashing. So yeah, this
Mm-hmm.
is the electric toothbrushes. I like mine, so I'm glad that you recommend that. Now, when
Sure. And
you, in terms of your patients, because you're a general dentist, what's the most common diagnosis that you see that one would go to see a dentist for? And also, in during this pandemic, COVID pandemic, what's the most common reason that people come to you that's aside from the prevention and screening that is extremely important?
well, as you know, COVID-19 has not been kind to our health over this past several months. It's pretty uncertain times, Pallavi. We have been seeing patients almost 30 to 40% increase in patients coming in with cracked teeth, in patients coming in with chipped fillings, in patients coming in with headaches, migraines that they feel it radiates from their jaws towards their head. So that's one set of patients that we see. Now, we know our patients and we know there are so many patients that have been avoiding or just postponing their treatments, even their regular dental cleaning due to fear of this COVID. So you see what I mean? We are in a fix right now. We want to help serve them better. We want to make them feel safe and sound. So we, all of our dentists, the whole dental community, we've been trying our best to follow all the safety measures and precautions to help keep them safe. So it's always a good idea. Call your dentist. Just ask them what are the measures that they're taking. Are they screening patients? Are they using masks all the time? Just get your doubts cleared. I believe that will definitely help you ease up and make that decision. Okay, should you go to a dentist now or should you just delay? That's one aspect, right? Now, another question that you asked is what kind of dental emergencies we see. Um, Grinding is one of the big things that we have been noticing, all the dentists have been noticing these days. We see patients coming in with sensitive teeth. So always keep an eye. Everybody who's listening, I want you to keep an eye. If your tooth starts getting too sensitive to any kind of heat or cold temperature changes, and if it feels like it's lingering around for minutes, several minutes to 20 minutes, that's a sign that you shouldn't be delaying that appointment. Just go see your dentist as soon as possible.
Ah, I see, I see. Yeah, no, I've actually had a lot of family members that say, I have a lot cold sensitivities. That's just how, it's just my general makeup. I just have that. So that's good to know that you should see a dentist if you have that, and that's, can be potentially abnormal. Now, given that it's Halloween, let's talk about Halloween candies. Is there a good versus bad candy?
Well, yes, absolutely. If you ask me as a dentist, I'm going to tell you there are some things that I have been actually lecturing my kids around because it's Halloween. It's a good time to eat candies. I know a lot of you people will get to the point that it's a good remembrance that you will notice you have some teeth that have been sensitive. So I would recommend just pretty simple things. Go sit with your kids and tell them this is important. Try to eat your candy during mealtime. Okay. Now, the good candy that Pallavi mentioned, I'm going to get to that. Good candy would be something that is not hard, that is not sticky to your tooth. So, anybody who likes chocolates, yes, that would be a good candy. Pallavi, try
Mm.
to stay away from hard candy, please, please, please. I'm telling you, it's the worst candy that you can get for your kids and for yourself. So think twice before picking hard candy. Another thing which I would say is consider gums if you're just craving sugar, because I know my house is full of cavities. I'm so sorry, full of Halloween candies lying around. And then whichever room I go to, I see cavities. Sometimes you're just so tempted, you try to eat it, but you don't realize how often you're eating. And that's one thing which is very important, frequency. Pallavi. More than amount of sugar that you eat, it's about how often you eat that sugar. So
Okay.
try to limit that. Try to eat your candy during meal times because you have a lot of saliva going around, and it's going to help flush away all the sugars from your teeth. If you feel like you want to eat candy, or if you're, consider if you're craving sugar, try chewing on xylitol gums. Xylitol gums would be a very good option if you want to just have that saliva keep going on and flush all the bacteria from your teeth. That should help.
Oh, okay, okay. Okay, those are very important points. That's good to know. Now, one other thing that I wanted to touch upon is I've heard vaguely this thing about oil pulling, but I know nothing about it. And so you at home might be wondering as well if you've even heard of it. But can you tell me what that is exactly?
So oil pulling, it's there's a lot of literature. If you look at literature around you, there's a lot of scientific studies that have been done. I personally haven't gotten really dig deep into it, but I know it does help to keep your oral structures healthy, and it helps to keep them, free from getting dry. So if you can imagine, you're having oil in your mouth, and what people do, they swish around. Coconut oil is what they use mostly, and they swish it around for a nice 5 minutes, 10 minutes until it becomes foam and frothy, and then they spit it out. So what it is going to do is it is going to create a layer of oil, or just a layer of slimy, oily substance on your teeth that is not going to let the bacteria sit on your teeth. That is not going to let the plaque sit on your teeth. So it basically creates a barrier in between, bacteria, oral bacteria, and your teeth. So it does help that way. Another way it helps, it also has some antioxidants. Again, as I said, I haven't gotten deeper into this, but I know for sure a lot of people have seen improvements in their oral health, in their gums, and just overall hygiene.
Oh, that's interesting. So you recommend it, and as a medical doctor, I would say don't swallow.
Yes, not to
As that
swallow.
can increase risk of cardiac disease, right? But that's interesting. Yeah, creating
Right.
that barrier from your teeth to the bacteria is makes a lot of sense actually. I didn't know this term oil pulling till recently, so that's wonderful. Thank you so much. So we've
Yep.
talked about my other questions like symptoms to see a dentist. You've done an excellent job, relaying that. Any other words of advice before we get Dr. Nadarajah on?
Um, I, I'm just going to sum it up real quick for you all. Just most important, do not ignore or delay your dental appointments just because some people have high pain tolerance if it gets sensitive. And again, this also pertains to our South Asian migrants. Pallavi, now we know our audience is mostly South Asians.
Yeah.
We are not grown up. A lot of people, a lot of us have not received preventive oral, practices. We don't practice that. A lot of us are used have our certain or habits, some myths that we follow. So it's not that easy to go along, to go along or understand everything about it, but you need to start at some point. Talk to your dentist, tell them what your barriers are, discuss with them what challenges you have had. If you have had any bad experience, dental experience, communicate with them. I am sure all of us are so keen and aware and trying to listen to what patients needs. So we'll definitely try to address those and help make it a better and a comfortable experience for everyone.
Sure, sure. Wonderful. And before, so one last question for you, Dr. Kokate. What is a good contact information if someone were to be interested in reaching out, especially our Northern Virginia folks? What is your office number, or what's a good way to reach you?
Sure. So it's I practice in Reston. Our practice is located right behind Reston Station. It's called Reston Station Dental. Pretty easy to remember, right? Right behind Reston Station, it's called Reston Station Dental.
Wonderful.
And
They could Google
address
that.
would, yes, absolutely. And the address is 1800 Michael Faraday. That is the location that we are at. We also have another location right next to it. It's called Paul Family Dental. So once you look it up, you'll know both of the practices are, it's together. You can try to just reach out to us, call our office if you want to be seen, make an appointment, even if you want to just get any, clear your doubts. If you have any concerns, just call them, let them know I am always around, Dr. Kokate, that's Kokate. I will be there. I'll try to answer your questions and I'll try to, satisfy all of your concerns there. I'm gonna.
Wonderful. Wonderful. Thank you so much. It's been an absolute delight to have you on, and emphasizing prevention is just absolutely brilliant. So now let's get Dr. Nadarajah on. And so Dr. Nadarajah is, as I mentioned earlier, has specialized in periodontal disease, gum disease. Dr. Nadarajah, can you tell us what is the prevalence, or how common is periodontal disease? Let me say gum disease, because that's easier word actually, among the adult population in the U.S.
Once again, thanks a lot for inviting me for this program, Dr. Gowda. I would say close to 47% of an adult over the age of 30 years has some form of gum disease. And if I have to speculate, immigrants from Southeast Asia, the number is going to be even higher. And as we get older, just like any other diseases, you're also going to have severe form of gum disease.
I see. Okay. And what are the contributing factors to getting gum disease, or risk factors? What are some bullet points that we can have someone at home listening to know about?
As Dr. Kokate mentioned, the main reason we have someone gets a gum disease is because of plaque, bacteria, poor oral hygiene. What I mean by that is not flossing, not keeping the teeth clean, not having a regular dental visit, checkup. The other factors are diabetes, smoking, family history of gum disease, pregnancy. All these are multifactorial. So that's why I think it's always preventable as long as you go to the dentist, get your teeth clean, have it checked, so that if they start to see any problems with their gums, such as bleeding, or when someone says my teeth are very sensitive or the roots are exposed, that is a warning sign that you need to address it before it gets too late.
I see. And one important point we should reiterate, and if you can kind of expand upon, is, so we had talked about gum disease being a risk factor for heart disease, or really any kind of chronic disease. But in our South Asians, it's just so prevalent that I want to relay to someone sitting at home and listening. What is the association? So if you have more gum disease, are you at an increased risk for heart disease?
So what the literature shows is that the plaque, which causes gum disease in the mouth, also travels through your bloodstream and clogs your arteries. So when they went and when they cleaned up the arteries which had the plaque buildup, some of the bacteria which was built up has the same bacteria which was causing gum disease in your mouth. And if you look at it, there's a protein called C-reactive protein that increases with gum disease and also increases with heart disease and heart attacks.
I see. And this association is also there with diabetes, correct?
Correct. So if someone has gum disease, and if that person also has uncontrolled diabetes, both are interlinked. What I mean by that is, if you don't treat your gum disease, you're not going to control your diabetes and vice versa.
I see. I see.
There are also studies to show that if you have, as a woman who has young mothers who have gum disease, and let's say they're also pregnant, then there are studies to show that if the gum disease is quite advanced, you're actually putting your baby at a risk, meaning you might have a premature birth of the baby, as well as the weight of the baby might be low compared to a normal baby. So gum disease as a chronic inflammation has so much of effects on the rest of the body.
Oh, I see. I see. Wow, that makes the first part of the talk with prevention so much more important, right? I feel like going and brushing my teeth just listening to this talk or being part of this discussion at least. So, what are some symptoms related to gum disease?
That's an excellent question, because a lot of people, I have patients who come and see me, tell me, hey doc, I brush my teeth and I see bleeding and I stop brushing because I think that I'm overdoing stuff. It's actually opposite. When someone is brushing, he or she notices some bleeding, the body is telling that person that something is wrong. You only start to see bleeding because there's inflammation, and the body is trying to tell you that you need to take care of it. If not, you're going to have other problems such as loosening of the bone, receding of the gums, and eventually tooth loss.
Oh, I see. I see. Okay. Yeah, very important to know. So if you have gums that bleed when you brush your teeth, that's not normal, and you should, speak to your dentist. That's a good point to take home. What are some different types of treatment options available if someone has gum disease?
The number one treatment is what's called regular cleaning, and also commonly called deep cleaning, where they numb me up and do a thorough cleaning. Sometimes you can treat gum disease with systemic antibiotic. There are cases where if none of these non-surgical therapy doesn't help a person, then there are surgical approach which can help to save teeth so that you don't lose these teeth.
Okay, interesting. And in terms of let's say dental implants, you see a lot of people having implants. One question that I know that patients have asked me is, should I try to keep my natural teeth, or should I go to dental implants to replace my teeth? What's your point of view on that?
That's an excellent question. I believe if we can hold on to the teeth what God gave us, that's the best. But you need to take care of them. So if you can save your natural teeth, you should always do that. Now, if you can't save teeth and the tooth has to be extracted and you have to replace with a dental implants are excellent. But just like your natural teeth, you still have to take care of it. If you don't take care of the implants and the teeth that are on the implant, then just like your natural teeth, you're going to have bleeding, you're going to have bone loss, and you're going to have problems. So if a person who has a dental implant also has a smoker, also has diabetes, that means they're going to have problems down the road. So they need to stop smoking, control their diabetes, and also, more importantly, floss and take care of your dental implants.
I see. Okay. So the theme of today's talk is take care of your teeth. And now, given that this is mainly a South Asian audience here, diet. Now, one thing that is near and dear to many South Asians is pan, for example. Can you tell us how that affects your health overall, your gums, and so forth?
So the betel nut has been recognized by the World Health Organization as a carcinogenic agent. And especially in Southeast Asia, where people use betel nut, tobacco leaf, and betel nut, just like in US, people chew gums, bubble gums. So the constant irritation of the mucosal tissue leads to oral cancer. So if we can avoid pan parak, betel nut, or tobacco product, that's going to help you a lot and save your life.
I see. I see. Well, I think that wraps up our show. I appreciate both of you being on today. It's an absolute delight on this Halloween day. Both of you are, helping me educate the public about dental health awareness. Dr. Nadaraja, Dr. Kokate, I want to thank you sincerely for coming on to the show and educating the public. Any last words, Dr. Kokate, any last words you want to say?
Well, I would just like to thank Dr. Nadarajah and you. Definitely, it was an informative session for me as well. I learned a lot, Dr. Nadarajah. Thank you so much. One more thing, Pallavi, before we disconnect. I know Manish is listening, so I just wanted to congratulate you as well. Speaking of beauty pageants, you yourself are second runner-up in the Mrs. India DC pageant. And you are such an accomplished person, Pallavi. So Manish, someday we need to have Pallavi on the guest seat there and we need to have somebody host. I am willing to host it, but I would love to hear your story as well.
And tell me which
I admire you, Pallavi.
Tell me about the pageant you were in.
Oh, so the pageant, that was last year when I represented India in pageant for Mrs. Asia USA. 2019, and I am a title holder for Excellence in Community Services. So it felt like a huge achievement when you are being recognized for something that you do from the core of your heart. Like that's very close to me. Community services, volunteering. So it was a huge success. I definitely learned a lot from that experience.
That's wonderful. So you're beautiful and brilliant. That's a great combination.
Well, coming from another beauty model. Thank you.
Dr. Nadaraja, I forgot to ask you now, a contact information if people want to reach out to you now that they're all educated about gums.
So my email address is www.perioimplantcenters of Maryland. I have an office in Frederick. My office number is 240-439-4872. And once again, thank you, Pallavi, for giving me the opportunity to talk to your DMV audience in this area.
Oh, wonderful, wonderful. And that was a website address. Thank you so much, both of you. You have a wonderful, happy Halloween. Stay safe during this COVID pandemic. And thank you once again.
Thank you. Thank you.
All right. Bye-bye. Manish, I'm going to hand it over to you. You have a wonderful day. Bye-bye.